To begin with, I'd like to talk a little bit about the different symptoms of ADHD and how the diagnosis is made. As you can see from the slide, attention deficit hyperactivity syndrome, basically it's in two parts. One part is the inattention part, and that's where children are easily distracted, forgetful, they may lose things, they have difficulty sustaining any attention, they avoid or dislike difficult tasks, difficulty organizing, careless mistakes, doesn't listen, difficulty following instructions. Those are all potential symptoms. For the hyperactive or impulsive side, these kids could be fidgety, difficulty staying in the seat, they run or climb excessively, hyper feeling. You can pretty much tell when they come into your office whether they have this kind of problem, because they're just all over my office. They're pulling down pictures, they're taking things off my desk, they're putting things on my desk, they're pulling out the scissors, all kinds of things like that. They're basically on the go all the time, like they're driven by a motor. They can talk excessively, they have difficulty waiting their turn, they blurt out answers, they interrupt or intrude often. So those are some or all of the signs that you can see in kids that have ADHD. And oftentimes there are conflicts with other potential disorders. So there's a differential diagnosis of this would be vision and hearing problems, chronic illness, breathing impairment, sleep apnea, sleep problems, sometimes developmental or learning problems, language deficits, seizures sometimes can show up like this, acute change in living situation, potentially causes of this sort of behavior. Sometimes substance abuse, side effects of certain medications will produce strange behavior symptoms, and obviously stress and other comorbidities, psychotic disorder, adjustment disorder, and so on. Martin wondered if he had ADHD. No matter how hard he tried, he just couldn't plan ahead. With learning with ADHD, you have sometimes as much as a 37 to 50% comorbidity with learning disabilities, 20 to 30% with anxiety. Some of these kids, 10 to 20% of them also have depression. 63 to 92% in some cases, they say that bipolar disorder may be associated with ADHD. OCD, obsessive compulsive disorder, 40%. Conduct disorder, 20%, and Tourette's or tic disorder, 7%. The CDC reports that the American Psychiatric Association states that between 3 to 7% of school-age children have ADHD. Parents report that approximately 9.5% or 5.4 million children between the ages of 4 and 17 have been diagnosed with ADHD. That's as of 2007. The percentage of children with a parent-reported ADHD diagnosis increased by 22% between 2003 and 2007. So this is definitely a growing problem. The prevalence is 4 to 11% in the United States, probably the same in Canada. The boys to girls ratio is 3 to 1, so it's 3 times as many boys as girls who have this problem. And the etiology is said to be multifactorial. Genetic, sometimes there's a family history, alcoholism, social pathology, learning disabilities, mood and anxiety disorders, these may all be connected. In the parent, the mother, if she's smoking and she uses alcohol during pregnancy, there may be an association. Gestational diabetes, head injuries, seizures, central nervous system infection, and all of these could be related to ADHD. Environmental risks, I'm going to speak later on about the connection to toxic heavy metals, lead, cadmium, also television exposure. Apparently, the more TV some of these kids watch, the more likely it is that they develop ADHD. And of course, there are cultural reasons for development. In the United States and Canada, there's a very high incidence of ADHD, but in Europe and Japan, the incidence is extremely low. And of course, there are many unknowns as to why kids develop ADHD. I mentioned TV. There are some studies that show a connection between frequent TV viewing and associated attention problems. So there are also studies that show that there's no connection. So this is an area of dispute. How can he have an attention deficit when he has so many nice things to hold his attention? As many of you know, a lot of kids spend a great deal of time with television, with video games, and with other distractions. So there's a lot to keep them from actually, paying enough attention in school and doing well in school. And the question has arisen, is there a problem with the brain? Well, they did a study, as reported in the National Academy of Science in 2007, on 446 kids with and without ADHD, and they were scanned. They were using different types of scans, and ADHD kids were found to lag 3 years in cortical growth. The ADHD kids had a motor cortex that matured earlier. So there was no evidence of any abnormality, just delay. So these kids had some kind of delay in brain development. But there are people that also say that ADHD is a made-up condition, a made-up diagnosis. One physician, Dr. Michael Anderson of Canton, Georgia, calls ADHD a made-up disorder, quote, unquote, an excuse for doctors to prescribe Adderall to treat poor academic performance in inadequate schools. So there are other issues involved with ADHD. You have to look at things like the quality of the teaching and whether or not there are good relationships, whether there's a problem in the family. So there's many other factors that could be involved. It's not necessarily a Ritalin deficiency disease. The NIH, that's the National Institute of Health, their consensus conclusions about ADHD, they say it's unclear if ADHD is at the far end of the spectrum of normal behavior or if it reflects a qualitatively different behavioral syndrome. There's a remarkable lack of research on the etiology or prevention of ADHD, and we know little about this. So that's what the NIH believes. What's a reptile dysfunction? I think that's to do more with learning disabilities. The rates of ADHD diagnosis increased an average of 3% per year from 1997 to 2006. Boys, apparently 13.2%, were more likely than girls, 5.6%, to have ever been diagnosed with ADHD. As of 2007, parents of 2.7 million youth ages 4 to 17 years report that their child was receiving medication treatment for the disorder. So the predominant form of treatment for ADHD is medication, prescription drugs. My teacher said I don't pay enough attention in class. At least that's what I think she said. The economic cost of this is outrageous. Using a prevalence rate of 5%, the annual societal cost of illness for ADHD is estimated to be between $36 and $52 billion. That's in 2005 dollars. It is estimated to be between $12,000 and $17,000 annually per individual per year. Across 10 countries, it was projected that ADHD was associated with 143.8 million lost days of productivity each year. Most of this loss can be attributed to ADHD and not co-occurring conditions. He may look healthy on the outside, but he's clearly suffering from ADHD. The prescribed use of stimulant medications to treat attention deficit disorder rose slowly but steadily from 1996 to 2008, according to a study conducted by the National Institutes of Health. And it's interesting, in 1 year, in the late 1990s, the company that manufactured Ritalin actually ran out of the product. So there was literally a Ritalin deficiency at that time. So in 1970, approximately 150,000 kids were taking Ritalin. 1980, 270,000 to 541,000, but in 2003, 2.5 million kids were on Ritalin. And unfortunately, the response to Ritalin is often poor. There's a poor response in 35% with no behavioral improvement. There are, of course, a lot of side effects. Some of the side effects: nausea, weight loss, insomnia, tics, irritability. The kid just doesn't feel himself, arrhythmias. And there are more serious side effects like liver dysfunction, psychosis, and I'll get into that more later on. There's also an increase in calls to the poison control centers. Ritalin has indeed killed some children. There's a problem with compliance. There's also a problem with the stigma. There's a problem with dependence. There's a lack of attention to other aspects of lifestyle that improve overall health and esteem. So parents will often, 30 to 40% of them will often seek other options. Many conditions can be misdiagnosed as ADHD, I mentioned before, and they include things like depression and bipolar disease, anxiety disorder, learning disabilities, and also some of these kids, they are apparently gifted, so they will not do well at school primarily because school is not challenging enough for them, and it really doesn't coincide with their goals, and their behavior as a result is poor. Intense or difficult temperament, boredom, and then of course I'm going to be speaking about vitamin and mineral deficiencies, toxic heavy metals, food and chemical intolerances or allergies, and candidiasis. All of these conditions can produce many of the symptoms or signs of ADHD. This child probably doesn't suffer from ADHD, but he looks like he's gotten lost somewhere. Now, it may surprise many people to know that Albert Einstein, one of the greatest geniuses of the last century, did not speak until he was 4 years old and did not read until he was 7. He was described as mentally slow, unsociable, and adrift in his foolish dreams. He was expelled from school and refused admittance to the Zurich Polytech Institute. Today, he would have been put on Ritalin. Shouldn't he have been medicated? What if Einstein was on Ritalin? There have been over the years many famous people that have exhibited signs of ADD or ADHD and been diagnosed that way, and they include people as crazy as Hans Christian Andersen, Andrew Carnegie, Churchill, Dwight Eisenhower, Robert Kennedy, Picasso, Edgar Allan Poe, Nolan Ryan, Pete Rose, Robin Williams, Stevie Wonder. There's a long list of them. Leonardo da Vinci. Leonardo da Vinci was known for his famous paintings like The Last Supper, but numerous of his drawings were found, most of which he never completed. He wasn't satisfied with the paint he was using, so he came up with his own. He was classified as having ADHD. ADD, are these your grades or your diagnosis? Other examples: Kenneth Branagh, Thomas Edison. He tried 9,999 times to perfect the light bulb and finally did it on his 10,000th attempt. Imagine telling that story to your average ADHD kid who typically gives up if he or she doesn't obtain the desired result after the first attempt. More ADHD examples: Gandhi, John Lennon. John Lennon was expelled from kindergarten. Woody Allen claims, "I paid attention to everything but teachers." What if they were on Ritalin, Adderall, or Dexedrine? Beethoven, Sir Isaac Newton, and Leo Tolstoy. All of these people could have been diagnosed with ADHD, and today many kids who have unusual talents or are different or think outside the box are oftentimes prescribed drugs. And why is Ritalin so controversial? Well, it's a Schedule II drug. The rating is given to prescription drugs that have the greatest abuse and dependence potential. Other drugs in the same category are morphine, opium, and cocaine. Ritalin is an amphetamine. Most of you know amphetamines as speed. All other ADHD drugs are different versions of speed. That's basically what they are. Listen, when the side effects of this medication kick in, you'll forget what was wrong in the first place. And I think that's the basis of which many of these medications work. They produce so many side effects that it abruptly changes the behavior, and what do you know? The kid is quiet. You get the effect you desire. But perhaps the best known effect of chronic stimulant administration, especially of Ritalin and some of these drugs, is psychosis. Psychosis has been associated with chronic use of several stimulants, mostly the amphetamines and cocaine. And these are some of the other side effects. I mentioned these before, but also things like hallucinations, addiction potential, and then stunting of growth. I've seen quite a few kids who have been on these stimulants for years, and they've stopped growing. Other symptoms, he's just not himself, he's lost her spark or her joy, he's not the same kid, he's teary or sad a lot, he's not as enthusiastic or creative. So these drugs basically retard creativity. And the Toronto Star in late September ran a series of articles on some of the side effects of ADHD drugs, and they reported that over the past 10 years there have been 600 or more serious side effects, including several deaths. Several kids who have had serious neurological problems, including strokes and seizure disorders and different psychotic events. Side effects of ADHD drugs shock parents. Well, they should shock parents. And then the other problem is that Ottawa keeps ADHD reports of these side effects secret. You can't get access to them. So if you really want to find out more about the side effects of these drugs and you want to phone up Health Canada, they're not going to release any of the information to you. Strattera, side effect, completed suicide. This is just one of nearly 600 cases of Canadian kids suffering serious, sometimes fatal side effects suspected to have been caused by ADHD medications in the past year. So the author of this report was David Bruiser, 2012, the Toronto Star. And Health Canada, which collects these adverse reactions, does not alert the public to the magnitude of these side effects. This is because the regulator has not analyzed the data it collects. It has allowed the industry to largely police itself. Health Canada seems to be more preoccupied with going after the removal of nutritional supplements from health food stores and the shelves of pharmacies, none of which have ever killed a single individual in the history of this country. It is primarily drug companies' responsibility to monitor the safe use of their products, Health Canada told the Star. I can go on about this, but we have limited amount of time. We've only got an hour. Dude, you're over-medicated. These are some of the excerpts from the Toronto Star articles. The Star also found 4 deaths that were not suicide, including an 18-year-old girl who died after a cerebral hemorrhage in 2011. The Star found side effects on most parts of the body: the brain, respiratory system, several organs, major organs, blood, skin, eyes, ears, and hair. So 20 kids developed psychotic disorders. More than 40 kids developed depression, 24 convulsions, 48 developed hallucinations. Well, there might be an alternative to Ritalin, and that is one of the things I'm going to be speaking about a little bit later. It's called exercise. It sure beats Ritalin. 20 overdoses, 8 of those intentional, including a 10-year-old boy on Ritalin, 3 strokes, 28 cases of heart problems. Ritalin and amphetamines alter the rhythm of the heart. They can produce arrhythmias, chest pain, ventricular fibrillation, and even heart attacks. There was an 8-year-old girl who suffered a heart attack after taking amphetamines. 23 cases involved side effects on the liver. One of the side effects of Ritalin is liver toxicity. Sleep disorders, convulsions, weight loss, muscle twitching. There's a whole list of these things. So I just wanted to report to you that when you are taking or have kids taking these drugs, it's not the same thing as taking a multiple vitamin and mineral supplement. And Health Canada keeps these reports secret. Health Canada has detailed records of probes into ADHD drug safety, including fatalities, that it is keeping secret from the public. Every 6 months to a year, drug companies submit summaries of side effects suspected to have been caused by their drugs worldwide, and the information goes to Health Canada, but these summaries, called periodic safety update reports, are not available to the public and are largely ignored. As this slide illustrates, on the far left you see all the wonderful things that Health Canada protects, including dangerous drugs, genetically modified foods, alcohol, tobacco, all of these are so safe and effective that nothing has been done about them. But on the far right, you see different nutritional supplements, including enzymes. They are now going after nattokinase and digestive enzymes and a whole list of other supplements that you will not find on your shelves in the next few years because Health Canada has deemed those things neither safe nor effective or unproven. Yet the real facts are that they've never hurt anybody, while these other drugs, which have been on the market for many years and have a long history of actually killing people, remain on the market. Just to give you an example here, a Bolton teen hanged himself from a tree 4 days after he started taking Cipralex, an antidepressant. His mother went online and filed a side effect report to Health Canada. A pediatrician troubled by the spate of side effects he was seeing in kids taking a generic version of an ADHD medication faxed 25 reports to Health Canada over 2 months. The STARS found Health Canada is not investing individual reports of serious side effects. So in other words, all of these things are basically ignored. So you can complain about these drugs all you want, and Health Canada just ignores them. Now, the question arises, if these drugs are on the market and they have all these horrible side effects, there must be a good reason why they're on the market. Maybe they magically or mystically help ADHD kids get better. But in actual fact, studies show that they don't. You may get a temporary improvement, but according to this study, a study by William Frankenberger and Christine Cannon at the Human Development Center at the University of Wisconsin, published in 1999, found that 13 ADHD children on medication performed progressively worse over 4 years on standardized tests when compared with a group of 13 normal children with similar IQs and other characteristics. So in other words, the longer you take these drugs, the more likely it is that your brain is going to deteriorate. And then there's the other issue, the negative research which has been withheld. Drug companies have been accused of failing to publish drug trials which do not give the right result. Published research suggested a type of antidepressant was safe for children, but unpublished data indicated it was not. The pharmaceutical industry said it was taking steps to solve this problem, but after looking at the unpublished trials, it was found that with the exception of fluoxetine, the risks exceeded the benefits. There is a book out there, how many of you have heard of Pharmageddon by David Healy? That book discusses some of the things, some of the tricks that the drug companies use to get their drugs on the market. And you can have 25 studies that show that Ritalin or these amphetamines eventually don't work, and yet they won't be published because the drug companies refuse to have them published. David Healy quotes, "Pregnant women who religiously steer clear of alcohol, tobacco, soft cheeses, or anything that might harm their unborn child are urged by their doctors to take antidepressants, despite the fact that there's an awful lot of evidence that these things can do some harm." This is a meeting of Attention Deficit Disorders Anonymous, and in order to get their attention, the moderator fired a gun. Anyway, I'm not a professional comedian, I'm sorry. The Globe and Mail reports, modern physicians believe good medicine comes from evidence produced by clinical trials that pit budding blockbuster drugs against placebos. But Healy argues that much of the evidence found in evidence-based medicine comes from clinical trials paid for by drug companies that are designed to show small yet statistically significant benefits of their medicines without demonstrating whether they actually benefit patients. So in other words, the studies are designed to show some minor improvement, and they are marketed as a way of quote-unquote treating or correcting behavior, and they really don't do that. Ritalin has also been linked to a greater incidence of crime. Well-known criminal defense attorney from Georgia, Melvin Nash, states that between 50 to 60% of the people he represents for everything from traffic violations to armed robbery have been on Ritalin at some point in their life. So Ritalin has been associated with that. It's been associated with murder, all kinds of suicides. But what doctors have been instructed to do when confronted with these issues is, as this lawyer is advising, first admit no harm. Children with ADHD have a higher risk for serious injury. The researchers reviewed 8 years of injury data on more than 61,000 children ages 3 to 17 and found that those with ADHD were nearly 80% more likely to be involved in serious accidents resulting in hospitalization or trauma. Ritalin is definitely dangerous and even addictive. And one of the other problems is that teens are selling Ritalin to other students as a form of recreation. They crush Ritalin and snort it like cocaine, or they cook it and inject it into their bloodstream. So it has a huge potential for abuse. And this type of use can cause heart attacks and strokes, according to many researchers. And we can also talk about these drugs causing liver tumors. And then the most interesting thing about Ritalin, there are 7 billion people in the world. Over 330 million of those live in the United States and Canada. The United States and Canada makes up 30% of the total population. Yet 95% of the Ritalin is consumed in the US and Canada. If ADD is so prevalent, then why does 25% of the population consume 95% of Ritalin? The national average for children on Ritalin in Canada and the United States is 5.6%. If you want to read more about this, I highly recommend this book called Brain Disabling Treatments in Psychiatry. It's written by Dr. Peter Breggin, who's a psychiatrist. And in the book, he details not only Ritalin, but the SSRIs, the antipsychotic medications. Many of these drugs alter not only the chemistry of the brain, but alter its structure. You can see that on various scans. And the other important thing to know about these drugs is that it's incredibly difficult to go off of them if you want to. You cannot suddenly stop Ritalin or any of these amphetamines. You can't suddenly stop the SSRIs because there are significant withdrawal reactions, including a worsening of the condition. So it has to be done very carefully. So the name of the book, once again, Brain Disabling Treatments in Psychiatry by Dr. Peter Breggin. I find medicine is the best of all trades because whether you do any good or not, you still get your money. And that was written by Molière, a physician in spite of himself in 1664. And they say that we should only fund evidence-based medicine. And then the person beside him says, you mean like Vioxx, Fen-Phen, Redux, SSRIs, Propulsid? See, all these drugs have been either taken off the market or have significant side effects and don't even work. So, you know, you may want to call this evidence-based, but it's really not evidence-based. It's quite the opposite. In animals chronically administered high doses of amphetamines, they produce long-lasting depletion of dopamine, alterations in dopamine uptake sites, and reduction in serotonergic activity. Methamphetamines in particular seem capable of inducing damage to serotonergic fibers. In monkeys, the toxic effects of chronic amphetamine use include damage to the cerebral blood vessels, neuronal loss, brain cell death, and microhemorrhages. So these aren't minor damages to the nervous system. Well, there's a side effect I've never seen before. So what do we do with ADHD? What can we do? Well, I believe in more of an integrative approach. It is important to see the child in the context of his or her family, friends, school, and community, and not just as someone with a set of symptoms one is trying to fix. Sometimes a change in the home environment, school, or teachers is more important than any medicine or herbal remedy. We've exhausted all conventional measures. One last desperate option is to put you on an alternative medicine that has a 96% success rate. So these are some of the stresses that we need to deal with. Chemicals, that includes aspartame or NutraSweet, smoke, alcohol, other toxins like lead, cadmium, arsenic, aluminum. Sometimes excessive copper can produce severe behavioral changes. Foods, sugar, yeast, food allergies, and sensitivities, these are all potentially triggers for abnormal behavior. And of course, deficiencies in zinc, magnesium, omega-3 fatty acids, and certain drugs like antibiotics and malnutrition that cause malnutrition. Poor communication, family dynamics, these are all things that we should look into. So some of the things I'm going to be speaking about are some of the basic principles of nutrition, food allergies, and then some nutritional supplements which may be of help in ADHD, and these include the omega-3 fatty acids, zinc, magnesium, and numerous other vitamins and minerals. I was taking Ritalin long before it became trendy. So some people it's trendy. These are some of the other alternative or complementary therapies that have been used with some success, and they include EEG neurofeedback, herbal or botanical approaches, homeopathy, craniosacral therapy, traditional Chinese medicine or acupuncture. There are other therapies. There's actually a school of thought that believes that good chiropractic treatment is effective for ADHD. Back to school special. One of the things that is very difficult for us to deal with, because it's something that we almost can't do anything about, is all the toxins in the environment that mothers are exposed to. There are an average of 200 industrial chemicals and pollutants that have been found in newborns. Of the 287 chemicals detected, 180 cause cancer in humans or animals, 217 are toxic to the brain and nervous system, and 208 cause birth defects or abnormal development in animal tests. And these are some of the toxins found in the umbilical cord. Some of the toxic heavy metals, they come from drinking water, air pollution, secondhand tobacco smoke. Even fish and seafood these days is so contaminated with PCBs, dioxins, mercury, and other chemicals that it's really difficult to get good nutrition from seafood. Antiperspirants, heavy traffic, pesticides, fertilizers, different kinds of medications we talked about, aluminum cookware, your amalgam fillings. Your fillings are made up 40 to 60% of mercury, copper, aluminum, and quite a few other heavy metals. And old paint. Old paint contains lead, which can be neurotoxic. Dental amalgam fillings. Amalgam fillings are made up of 40% mercury, nickel, cadmium, and copper. Paint. Mercury from older vaccines. That's another interesting one, because with kids getting so many vaccines, they in many cases are exposed to a lot of mercury or aluminum. Pesticides, including sprays used indoors, common household chemicals like nail polish, acetone, and perchloroethylene, a chemical used in dry cleaning. So dry cleaning as well. There have been some good studies on sugar, and there have been quite a few that say that sugar has nothing to do with ADHD. There have been some good studies, though, on artificial colors, flavors, preservatives, additives in our food. And this remains an area of controversy, but as many of you have seen, if you change the diet and you get rid of a lot of the chemicals or additives or salicylates, as Dr. Ben Feingold has said, that you can make some amazingly beneficial changes to childhood behavior. And then, of course, there are supplements like magnesium, zinc, iron. These may all be very helpful. When did Pop-Tarts become a breakfast food? I don't know when. So it's important in terms of helping these children to maintain normal blood sugar levels, and that includes limiting sugar and processed carbohydrates and balancing it with adequate amounts of protein. And following a low glycemic index diet seems to help a lot of kids. Here's what happens. A child eats a breakfast that has no fat, no protein, and a high glycemic index. Let's say a bagel with fat-free cream cheese. His blood sugar goes up, but pretty soon it crashes, which triggers the release of stress hormones like adrenaline. What you're left with around 10 a.m. is a kid with low blood sugar and lots of adrenaline circulating in his bloodstream. And then he goes to the guidance counselor, and he says to him, "We'll discuss your behavior in a moment, Billy, but in the meantime, why don't you help yourself to a nice piece of candy?" He's jittery and fidgety and not paying attention. That's going to look an awful lot like an ADHD to his children. The possibility exists that in children predisposed to ADHD, the quality of the diet may have an additional impact. So these are the methods or the weapons of mass destruction. These are foods that are high in sugar, they're nutrient depleted, fiber depleted, they contain oxidized fats, trans fatty acids, and lots of additives. So these are basically the foods you want to avoid. And what you should do in order to get started on this is what's called an elimination diet. You try to remove the potentially sensitive foods for a couple of weeks, and then you challenge one food at a time. You can keep a diary, and it's difficult to do this, so the parents have to be highly motivated. There have been some studies to show that these techniques work quite well in isolating what the foods are. And here's one study. This is from the Archives of Disease in Childhood in 2004. 273 three-year-old children with hyperactivity enrolled in this double-blind, placebo-controlled study. And they were given a diet free of food coloring and preservatives, then a daily drink with colorings and sodium benzenate. And there were significant increases in hyperactivity when getting the active mixture. So if you wanted to test this out, you can do this with the elimination diet the best way. This, I thought, was a real true advertising for a camp for ADHD children called Camp Run Amok, but I think what I realized later on was that it was actually a cartoon. It was a joke. There's no such camp as Camp Run Amok. This is another study showing the benefits of food elimination and eliminating food and chemical hypersensitivity allergens. And here's one study that was done, reported in The Lancet as way back as 1985, where they showed that a double-blind placebo-controlled study was able to reproduce the symptoms. The chemicals were able to reproduce the symptoms in children that were hyperactive. And this originally was something that was brought to the attention of the world by Dr. Ben Feingold, the Feingold hypothesis. He wrote a book called Why Your Child is Hyperactive, and he found that children were sensitive to dietary salicylates and artificially added colors, flavors, and preservatives. Learning and behavior problems, including ADHD, can be reduced by eliminating or removing these substances from the diet. And that's the book. It was written in the 1970s, and I still think today it has some powerful message to deliver. At least 8 controlled studies have demonstrated significant improvement with the elimination diet compared to a placebo, or deterioration after introducing the offending substances. So food allergies, a number of good scientific studies have shown that some children with ADHD will have significant improvement in their symptoms if taken off foods or additives they are sensitive to. The commonest ones appear to be gluten and dairy products, but also eggs, soy products, yeast, and different kinds of sugars are involved. As this cartoon says, I'll trade you my gluten-free sandwich for your lactose-free milk. As I said before, there's some good news about, there's some, different viewpoints on the use of sugar, and how there have been some studies that show that sugar doesn't really make much of a difference, but there are good studies that show that if children are sensitive to various additives or chemicals, that if you also eliminate the sugar, you have a much better result. Okay, that's more studies like that from the Lancet. So how do you test for food sensitivities? I mentioned the elimination diet. You can do this by eliminating whole classes of foods and then adding them back one by one. There's a book written by Dr. William Crook called Tracking Down Hidden Food Allergies. It's a very simple book. It's something like 30 or 40 pages, and it shows you how to put this into practice. It's something that anybody can apply. Then if you have difficulty in doing that kind of thing, there are some allergy tests available. There's something called the IgG RAST, and it's offered by Gamma Dynacare. Gamma Dynacare is a chain of laboratories in Toronto, and their main number 905-790-3000. If you call them up, you can get some information about the test. But any physician in Ontario can order the IgG RAST, and the cost of it is somewhere between $250 and $325, depending on how many foods you get tested. There are also other blood tests known as ALCAT tests and the ELISA-ACT test, and those are far more expensive. you have to send the blood down to the States in order to get the results. And then, of course, a lot of chiropractors, naturopaths, or nutritionists are using electrodermal testing for foods. These are things like the Intero machine, the Vega test. Some people do muscle testing. So it depends on the individual practitioner that you see. All of these tests are not 100%, so you have to go a lot by your experience as well, and you have to see what you're reacting to. So personal experience is also very important. So it's not just a matter of looking at the test results. You have to take into account the history, what the child is eating, what the child is not eating, and so on. These are the fundamental 5 F's of dealing with ADHD: fitness and sleep, more exercise, more sleep. The more exercise and the more sleep that a child gets, the more likely it is that they will perform better. And we talked about food and chemical sensitivities, that's important. But there are also other issues: friendship with self, emotional, mental, spiritual attention, dealing with frustration and stress management. All of those are very important too. Friendship with others, how much a child participates. If a child doesn't spend very much time with exercise or outdoors or with sports or with anything outside the home, then they're less likely to behave normally, or according to the way the teachers and the parents want them to behave. So social skills are developed with friendships with others. And then, of course, you have to look at the environment, getting the child more in touch with nature, mindful music, less TV, less video games, and getting them more involved in outdoors. So I don't have much time to spend here because I want to get to some of the other things. We talked a lot about the diet and some of the symptoms that you can get. One of the most important treatments as far as supplements is concerned is omega-3 fatty acids. Omega-3 fatty acids are polyunsaturated, meaning they contain more than one double bond. They are called omega-3 because the first double bond, counting from the methyl end of the fatty acid, is located at the 3rd carbon atom. So these are the omega-3 fatty acids: ALA, or alpha-linolenic acid, eicosapentaenoic acid, or EPA, and docosahexaenoic acid, DHA. So those are the most important omega-3 fatty acids, and they're the ones involved with the most benefit in ADHD and many neurological conditions. Humans synthesize other omega-3 fatty acids from ALA, so they make EPA and DHA from the ALA from vegetarian sources, or they can get them marine-derived, so from fish and seafood. ALA is considered plant-derived, so the sources of ALA, so the most common sources are flaxseed, walnuts, canola, which a lot of people don't believe is very healthy, mustard oil, soybean oil, walnuts, olive oil, and broccoli. Those are all sources of ALA, and then when you consume those, the body converts them into EPA and DHA. So those are the main sources there. You can see herring, salmon, Pacific salmon, oysters, trout, tuna, crab, shrimp, and the list goes on. So those are all the sources of omega-3s. And there have been a lot of studies on the benefits of omega-3s in ADHD. In one trial, which was reported in 2002, 41 children with ADHD and LD were given omega-3s for 12 weeks or a placebo. After 12 weeks, the children in the treatment group had significant improvement in their ADHD scores compared to a placebo. Usually, between 6 and 12 weeks, you will see some benefit. And there have been quite a few other studies. 2012, Nutrition, the journal Nutrition reported on a larger study. And one of the problems with vegans or vegetarians who do not consume any animal products is that they may have a problem converting ALA into EPA or DHA. A possible cause for the low fish oil status of the ADHD children may be impaired conversion of the fatty acid precursors LA and ALA to their longer and highly unsaturated products EPA and DHA. So this is important to realize. So there are some people who want to consume the flaxseed and not take any of the fish oils, and what they'll have to do is they may need to take a supplement in either a capsule form or get it from some other source. These are some of the symptoms suggesting EFA deficiency: dry, flaky skin, chicken skin or bumps on the outer arms, thighs, or cheeks, brittle, soft, or splitting fingernails, dry hair, hyperactivity, eczema, asthma. Okay, these are some more studies. What about magnesium? There have been some studies using magnesium in the treatment of ADHD, and so far what has been reported is that it may help with some of the overactive or the hyperactive behavior. There are some studies on flaxseed oil and vitamin C supplements combined. They improve ADHD, and also vitamin D. Vitamin D may be very important. Some of the symptoms of ADHD may be misdiagnosed because we're overlooking a vitamin D deficiency. Normally we get vitamin D from the sun, but if you get a little bit too baked, you may need to take a supplement instead. Smoking is another factor in ADD and ADHD, so that's something you want to watch out for. And antibiotics, a lot of antibiotics. If you overuse antibiotics, it's one of the unfortunate side effects. We talked a little bit about sugar. It wasn't me jumping up and down and yelling in class, it was the sugar talking. And the chemicals, okay. One of the other things is candidiasis, also known as dysbiosis. If you have an overgrowth of candida, William Crook and many other authors have reported that too much of candida in your system, which is the result of consuming too much sugar, refined carbohydrates, and having food allergies, that can increase the population of candida in your system and lead to many of the signs and symptoms of ADD and ADHD. So dealing with that is also important. I want to talk a little bit about amino acid supplements. There's an amino acid called theanine, which is an extract of green tea, and it's wonderful for reducing many of the symptoms of anxiety, nervousness, insomnia, irritability, and ADHD. It allows children not only to be calmer, but to be more focused. The reason why it's thought to do that is because it increases the alpha waves in the brain. And when you do that, you improve hyperactivity and ADHD. And another one that may be very beneficial is GABA, gamma-aminobutyric acid. That also does the same thing, but it's a little bit more powerful. It's an amino acid as well. The pharmaceutical industry has taken advantage of GABA by creating drugs like gabapentin, which are on prescription, but you can get GABA still from your health food store shelves. That's until Health Canada gets to it. And it's very effective for quite a few things. Magnesium glycinate, this is a form of magnesium which does not cause diarrhea. One of the problems with magnesium, if you take too much, your bowels become a little bit too loose and you can't get up to a therapeutic dose fast enough to produce the results that you want. So magnesium glycinate is one of the things that may help relax and improve thinking. I have only a few more minutes left. There are several combination products that contain magnesium, GABA, and L-theanine, and one of them is Calm Supremacy, which you'll find in the health food stores. A little bit about iron and zinc. They're also very important. I always try to do a ferritin level on kids who have ADHD because many of them are deficient in iron, and iron supplementation may help a great deal in school performance. The same goes for zinc. So you could test for zinc in the hair mineral analysis will tell you about the zinc level. And there have been a number of studies as far back as 1990 on zinc and ADHD and the benefits of zinc supplementation. This is what zinc deficiency may look like with kids. Oftentimes they'll have white spots on their fingernails, or they'll have these horizontal ridges on their fingernails that's known as washboard nails. So if you see that on kids, you can pretty much bet they have a zinc deficiency. Okay, I think my time is pretty much up. We have maybe a few minutes for questions. Yes?
Do you know if Canadian schools get extra funding if kids are diagnosed with ADHD?
Do I know if children in Canadian school get extra funding?
No, if the school gets extra funding if the child is diagnosed with ADHD.
I have heard that schools get extra funding.
I know they do in the States, I just wanted to.
Yeah, I think they do.
There's a lot of push in the schools.
Yeah. Yes.
What do you think of krill oil?
Krill oil is a very good source of omega-3 fatty acids. It's one of the more concentrated sources, so it's actually a very good source.
So less toxic, do you think?
Well, I think all the companies now try to remove the mercury and all the toxins from their fish oil supplements. They wouldn't actually get approval unless they had the toxicology report, so it's pretty sure that they don't have any toxins in it.
Is that what we look for on the omega-3 fish oils?
Yes, yes, that's right. Yes, in the back. I'm sorry, I didn't hear that. Well, I think a minimum of 2,000 units, but I've seen so many kids with low vitamin D blood levels that I've been recommending between 5,000 and 10,000, and then checking the blood levels later on.